Hey UCF, my name is Becky and I'm an athletic trainer at the Recreation and Wellness Center. Last week I touched on risk factors with knee pain, specifically patellofemoral pain disorder, and today I'll be talking about rehab and prevention techniques. As always, the treatment of your pain should include both a preventative and rehabilitative factor. From the prevention side, make sure you are gradually increasing the duration and intensity of your activity to avoid overuse of your knee. Also consider your current footwear and make sure the soles of your shoes are not worn out and that you have the proper support for your arch. Now onto some rehab exercises. The first exercise is a straight leg raise. Here you're going to lay on your back with your resting leg bent and the activating leg straight. You will tighten your quads to lift the leg about 1 foot off the floor, hold for a second, then slowly lower back to the floor. The second exercise is an outer hip raise. Please start by lying on one side with your supporting leg bent. Your moving leg should be completely straight as you lift the hip off the floor and into the air. You should actually feel this exercise within your glutes. The third exercise is an inner hip raise. So this is similar to the outer hip raise, except the working leg is the one on the ground while the resting leg is crossed over for support. This movement may feel awkward or that you are not raising it as high as other movements, but even a small lift can work your inner thigh muscles. The fourth and final exercise is a glute bridge. You can do these with an object like a chair or simply on the ground. Keep both feet planted on the ground or object and lift your hips by squeezing your glutes and abdominal muscles. Make sure that you are not overarching your back during this movement. All of these strengthening exercises should be done within 10 to 15 repetitions with a 2 or 3 set max. In addition to strengthening exercises, it is important to incorporate quadricep and hamstring stretches. So please add these into your routine at the end of your rehabilitation exercises as well as throughout the day. One last tip. If you are currently experiencing knee pain, putting a bag of ice or frozen peas on your knee for 10 minutes a few times throughout the day will help reduce any pain or soreness. I hope this video was helpful and I will be back next week. Thanks and go Knights!